I've decided to produce this video for my English-speaking patients. You see, I have a lot of English-speaking patients, and the problem is that in my contacts, I cannot do a correct selection. So I'm going to produce a video explaining what's related to coronavirus with the actual numbers. And if you want to see the next videos, please subscribe so you can see the next videos. I cannot start telling my patients through WhatsApp that I have new videos. I will try to produce a video every 2 days to put numbers updated. This is very important, but I'd like to stress that it's not the numbers that are important, but the discussion regarding the numbers. And you'll see why right now. What do we have now as of today? Almost 24,000 cases, 23,906, almost 24,000. Well, that's a lot. But you have 99% of these cases in China. Exactly 23,694 cases in China. 212 cases in the world, except China. Now, let's take a look at mortality rate, because that gives us a very good idea of how serious the situation is. And that's my point. You'll see. We have in Hubei, which is the province where the virus started, the city of Wuhan is in Hubei. We have almost 17,000 cases, while in the rest of China, we have 7,016 cases. Now, what's very interesting is that in Hubei, we have almost 480 dead people, 479 to be precise, and in the rest of China, only 11. What's the mortality rate for this? It's 2.8% for Hubei and only 0.15% in the rest of China. 2.8% means that almost you have one dead person for every 30 sick people. And 0.15% means that you have only one dead person for 666 cases. That's 25 times less. 20 times less, I'm sorry. So please pay attention. We have a totally different mortality rate regarding Hubei and the rest of China. What's the mortality rate for the rest of the world? Well, unfortunately, we don't know. I'll tell you why. We have 212 cases and we have 2 people who died. That gives us a mortality of 1%. But can you trust this number? No, you cannot. And why? Because when you have only 212 people, this is not enough to make statistical calculations. You cannot do that. You might have some bad luck with these guys who unfortunately died, and then you will have a wrong idea of what's going on. Now, when you have 7,016 cases, this is something you can trust. These numbers are correct. So, what we have, in fact, excluding Hubei for China, is 0.15% mortality. Why am I insisting with this? Because I'll give you a number that you're going to be very surprised. I was extremely surprised. You know what's the mortality rate for the influenza season in United States? Center for Disease Control data again? Well, I'll tell you and you'll see. Season of 2010-2011, 0.17% with vaccination. Season of 2011-2012, 0.13%. 2012-2013, 0.12%. And it goes like this, and it doesn't change a lot. 2014-2015, it was 0.17%, more than what we have now for coronavirus without a vaccine. Now check your numbers. This is very important. Unfortunately, the season of 18-19, the preliminary, the estimate data is that we have only 0.09, which is a lot better, almost half. But please be careful that even with the vaccination, as not everybody gets the vaccine, and you might even get sick even with the vaccination, we have exactly the same mortality that we have for coronavirus in the China except Hubei. So do we need to get hysterical with this coronavirus? Is this a reason to produce mass hysteria as we see it now, with people walking with masks everywhere? I doubt it. I think we need to be very careful. Of course, it's a new virus. We don't really know what's going to happen. But there's another thing which is important too. Respiratory virus, they behave differently in winter and summer. And this is why we get vaccinated and we have more cases during winter season. So that changes probably the way this coronavirus is going to spread, because it's a respiratory virus. So that changes a lot when you talk about northern hemisphere and southern hemisphere, if it's winter or summer. This is one difference. The second difference is the level of treatment you get. Why do we have this enormous amount of deaths, almost 1 people who dies out of 30 who get sick in Hubei? Well, I have an idea. It's probably because they don't have hospitals. That puts mortality a lot higher. And how can you think this? Well, I'll tell you. Why does Chinese government need to build a hospital in 10 days with 1,000 beds? Probably hospitals were overcrowded and they couldn't put people in intensive care unit when they needed it. So people died. And that's what the Chinese government is saying when it puts up a hospital in 10 days. Now, the second thing, when you study infectious diseases, you know that once you reach a certain level of people infected, the infection spreads a lot faster. This is because everybody's sick. So that changes totally what we know about transmission. You see, I'll give you an idea of what's going on in the world regarding coronavirus cases. It started January 24. We had 25 cases. The next day, 40. The next day, 57. And I keep on counting. 64, 87, 105, 118, 153, 173, 183, 188, 199, 94, and now 212. You see that first, this is not a huge growth, absolutely not exponential. It's just more cases, but not the enormous amount that we see in China from day to day. Yesterday, the cases in China, we had 20,500 cases. Now we have almost 24,000 cases. It's a lot more. And that's probably because in Hubei, cases are getting worse and worse. More cases because the epidemic is getting to everybody. So, another detail that I forgot now, I need to tell you, it's about Ebola. You remember when we had the epidemics of Ebola, the epidemic? Well, guess how many people died outside of Africa? No one. That means that when you get good medical care, mortality can change a lot. So please, what we need to do now is keep an eye on this infection. Of course, it's a new thing. We don't really know what's going on. We need to be careful. When World Health Organization says it's an emergency for the world, that doesn't mean we have the epidemic all over the world. It's not pandemic. It's just that the cases are reaching a lot of countries besides China. But it does not mean we have a pandemic. It's a different thing. It's just to tell that other people are getting sick and they do not live in China. That's what it means, only this. We need to analyze further numbers. I will produce next videos to show you the numbers. So please subscribe to my channel if you want to be informed. I cannot continue to put people watching my channel with WhatsApp. It takes a lot of time and I don't have this time, unfortunately. I would love to, but I cannot. So please come back again in 2 days if you want to see next videos. Well, I hope I have clarified a few things that are very important. We need to understand the numbers. We need to analyze the numbers. Otherwise, it's mass hysteria and it doesn't lead us anywhere. Have a nice day.